So the crisis in our healthcare system has seen doctors speaking out, emergency agencies being called in, and patients waiting and wondering about their care. We're joined this morning by Tammy Digiovanni. She's the Senior Vice President and Chief Nursing Executive at CHEO, the Children's Hospital of Eastern Ontario. Thanks for joining us this morning. I know it's a very busy time for you.
Good morning.
Tammy, yours is one of the children's hospitals across this country reeling from this impact of RSV, flu, and COVID. You also made headlines over your need to call in the Red Cross. And here's just one of the reasons why. Only 10 of the 130 beds are free. So how long do you see CHEO being in this position where you need an outside agency to come in so that you guys can get to the work that you need to do?
Well, far be it for me to predict what viruses will do, because they've been shown over the past years to be unpredictable. But at this point, our best guess in working with the forecasters is that we're looking at this volume of activity through till January. And so really what that's meant for us is that we're all hands on deck. And when I mean all hands on deck, that means that we're redeploying staff, medical staff, non-clinical staff from different areas of the hospital. We've had to decrease our activity in clinics, in our sleep lab, to cancel surgeries in order to do this, to take care of the kids that need us, that need admission to hospital. And so that's meant that we've been looking for all sorts of out-of-the-box solutions that we've never really thought of before. So we're partnering with many people, with the adult hospitals, with Roger Nielsen House, and with agencies like the Red Cross that can bring us that additional support and extra set of hands to support the clinical team. So they're working in non-clinical roles overnight, so that some of our staff that's been redeployed can get back to their regular jobs and also have a break, because we've been at this for several months now.
Well, and that's the question I have for you. Is this the breaking point?
I don't know that healthcare workers would ever say that. They continue to rise to the occasion no matter what is thrown at them. What I can tell you is that for many that are working in the system, particularly in pediatrics, they would say that this isn't a surprise. So we've had an undersized system for many years. We've had to cancel surgeries. We've been in surge for much less periods of time, but it's not a surprise that we're here because really our population has grown and the children's healthcare system actually has shrunk over that time. And in some ways, that's a good news story because kids bounce back. They don't need admission after surgery as long as they used to in the past. But it means that our population has grown. Our healthcare system hasn't grown with it. And so we really are stretched beyond our capacity, and we can't deal with these unexpected surges.
Well, I think that as a client, as a patient, as a parent, that's what I look at. This is a publicly funded system that has been in crisis for a while. We've been living in crisis mode for 3 years now. I sometimes wonder if there is not an urgency to get things done because of the nature of people in healthcare, which is to always do whatever it takes to get the job done. But that means the job is getting done. What would be the breaking point? Like, what would say to people, this is a fix that needs to happen now?
Well, you know, the fact that 35% of patients at CHEO were waiting for longer than was clinically necessary going into this pandemic, that rose to over 50% during the pandemic, and now we're canceling more surgeries. The fact that our waits in the emergency department are unbelievably long on some days, you know, I feel like that's our wake-up call. That, you know, the healthcare workers have really, like you said, they make it work for the patients and families, and they will continue to do so. It's time for us to step up and create a sustainable future for the kids in our society.
And it's heartbreaking that the onus of that is falling on healthcare providers like yourself to have to do that while you're also providing hallway care and calling in outside agencies to run and do your jobs. Parents who are listening to this interview know about these wait times. They've experienced them. So can you let us know, when should parents be taking their kids to emergency? Because the flip side of that is if they keep them at home too long, we could also run into problems.
Absolutely. And, you know, I can appreciate that that's one of the most difficult calls as a parent. You're looking at your child, you know the child the best, and you're trying to decide to do what's right for them. And so, you know, a lot of information is available on our website. And so some of that is being prepared before you're in that situation. So reach out, understand what community clinics are available, understand how you would reach your primary care provider. And there's information on all of the pediatric website, the hospital websites, but particularly at CHEO, about when to come to the hospital. So what to look for, what are the signs to be most concerned about, and when it's time to come in. And, you know, for the sickest kids, we're always there for you. Our doors never never close.
I want to thank you for your time this morning.
Thanks, Anne-Marie.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.